Assalamu alaikum, doctors. Myself, Mohammad Asim Hussain, working as product manager in Genix Pharmaceutical. Dear doctors, welcome in webinar session on behalf of Genix Pharmaceutical Management. Genix Pharma was founded in the year 2004. We have joined vision to help and provide top quality and affordable medicine for all those needs. Genix is being one of the fastest growing company in Pakistan pharmaceutical arena. We remain committed to improving the lives of pupils associated with us at all levels because we are dedicated to good health. Today, our session is a part of educational activity and presentation is topic is very unique and very useful for especially for physician. That is anxiolytic and neuropathic pain related to pregabalin. You know, pregabalin is very commonly used, but right dose and right dose is very important and right education. So presented by well-known consultant neurologist Dr. Rekha Kumari from Hyderabad. Dr. Rekha Kumari is assistant professor of neurology, Bilawal Medical College, Liaquat University, and Medical Health, Hyderabad. She is professionally very busy person, but always available for education. Thank you so much, madam, to join us. Dear doctor, if there is any query, please drop your question in chat box. Question answer session will be the after presentation. Over to you, ma'am.
Assalamu alaikum everyone. Welcome you all to my webinar. Today I'm going to present a topic that is very relative and very important in today's era because you all know that diabetes and hypertension is very common. So neuropathic pain is very common and we are going to discuss the drug Pregabalin. Its anxiolytic and neuropathic management guidelines and consideration. Pregabalin, that is very commonly prescribed medication, is a medication that is commonly used for the treatment of both anxiety disorder, pain, and pain. It belongs to the class of medication known as anticonvulsant or antiepileptic. Pregabalin works in different ways. In epilepsy, it stops seizures by reducing the abnormal activity in the brain. With nerve pain, it blocks pain by affecting the pain messages traveling through the brain down the spine. In anxiety, it stops your brain from releasing the chemical that makes you feel anxious. In the context of neuropathic pain, pregabalin is approved for the various conditions such as diabetic neuropathy, post-herpetic neuralgias, that is the pain followed by shingles, and fibromyalgia. It is believed to work by reducing the hyperexcitability of nerves and dampening the abnormal pain signaling. So, FDA approved pregabalin in 2004. Its FDA approved indications are diabetic neuropathy, pain associated with spinal cord injury, neuropathic pain associated with post-herpetic neuralgia, fibromyalgia, and it is used in adjuvant therapy for the partial onset seizures in adults as well as in children. But it is off-label use for generalized anxiety disorder, social anxiety disorder, bipolar disorder, insomnia, chronic pain condition, chronic pruritus, cough, and restless leg syndrome. How it works as an anxiolytic. It exerts its anxiolytic effect through binding to alpha to delta subunit of voltage gated calcium channel. It works by binding to alpha to delta subunit of voltage gated calcium channel in the nervous system, which helps reduce the release of certain neurotransmitters involved in anxiety. So, it is approved for the treatment of generalized anxiety disorder. So what is its dose that is being used and how much it is safer? So in generalized anxiety disorder, 150 milligram per day divided in 2 to 3 doses can be used initially. We can go for the maximum of 600 milligram per day. In social anxiety disorder, it is started with 75 milligram per day divided into 2 to 3 doses, while it also can be increased to 600 milligram per day. Side effect, its major side effects are that are cosmetically very important. They are peripheral edema and weight gain. It can cause swelling in the extremities such as hands, feet, and ankle, and it leads to significant weight gain in some of the population. If it has some idiosyncratic reaction, When it causes swelling of the hand, feet, and ankle, along with swelling around the larynx, then it is an emergency. Drug should be stopped. Other side effects are CNS effects, dizziness, somnolence, fatigue, confusion, difficulty in concentrating, and memory impairment. Gastrointestinal side effect includes dry mouth, constipation, and nausea. Visual disturbance include blurred vision and abnormal vision. This is a table that is comparing pregabalin versus benzodiazepines. You all know pregabalin can be used as anticonvulsant, while benzodiazepine has been used as an anticonvulsant and to stop the seizure immediately from very ancient times. So pregabalin is approved for the treatment of GI anxiety disorder and social anxiety disorder, but it is not the first line treatment. Benzodiazepines are used for the various anxiety disorders, including generalized anxiety disorder, panic disorder, social anxiety disorder. They are prescribed for acute anxiety symptoms, insomnia, muscle spasm, and seizures. Pregabalin may take few days to weeks for its action, while benzodiazepine has rapid set of action. Pregabalin is often used as a long-term management of chronic anxiety disorder. Its effectiveness may continue with sustained use. Benzodiazepine are typically prescribed for short-term use due to risk of dependence and tolerance development. They are often used for the acute symptoms. Side effect, as pregabalin side effect, I already told you, they are somnolence, fatigue, weight gain, peripheral edema, GI disturbance, and visual disturbances. Benzodiazepine causes lethargy, drowsiness, reduced alertness, affect memory, attention, and concentration, motor impairment, and paradoxical reactions. Now, the main topic or our concern in today's setup is neuropathic pain. So, what is neuropathic pain? It is defined as pain arising as a direct consequences of lesion or disease affecting somatosensory system. While nociceptive pain is produced by direct damage to tissue involved, abnormally stimulated nerves are believed to play a key role in neuropathic pain. This can result from nerve damage caused by trauma or certain condition, mainly diabetes, herpes zoster, and trigeminal neuralgia. So, herpes zoster doesn't cause the acute pain, but it causes pain in the forms of shingle. What are shingle? There are cluster of tiny bumps transforming into blisters, and they are filled with pus. These blisters break down and form crust over the nerve, and then it disappears. Painful condition, this post-herpetic neuralgia caused by nerve damage sometimes occur and can last after the rash disappears. So this is the picture showing shingles. Neuropathic pain, it can be defined as, it can be identified as burning, shooting, tingling, electrical shock, sharp and nagging pain. Patient feels like he or she is walking on the hot coal. Pain is often worse at night, may be paroxysmal or continuous. Characteristic signs and symptoms are hyperalgesia, that is defined as increased sensitivity to normal pain stimulus, allodynia, pain created by stimulus that is otherwise not painful, like application of cotton swab, wearing of the cloths. They can present with autonomic sign and symptom, skin pallor, skin changes, edema, change of perspiration, motor dysfunction such as weakness and paralysis. Patient believes that and perception of pain and its cause, coping strategy, mood changes, disturbed sleep, and anxiety all need to be addressed. Therefore, treating anxiety or depression first might also reduce the need for analgesics. What is the mechanism of action? As I've already described that its effect on the calcium channels and it causes modulation of calcium channel activity. It's indicated in neuropathic pain. FDA approved indication are diabetic neuropathy, post-herpetic neuralgia and fibromyalgia, while it is off-label use for other neuropathic syndrome such as peripheral neuropathy and trigeminal neuralgia. Many clinical studies and guidelines like American Diabetes Association, European Federation of the Neurological Society, and NICE demonstrate efficacy of pregabalin in treatment of neuropathic pain. Clinically prove that pregabalin may be used as a pain intensity reduction, improve sleep, and functional outcome. What is the dose? There are different doses for the different conditions. In terms of diabetic neuropathy, initial dose is 50 milligram thrice a day. That can be increased to 100 milligram and can go up to 300 milligram. While the post-herpetic neuralgia, it is used in higher dosage, starting with 150 to 300 milligram. We can go up to maximum of 600 milligram. For the fibromyalgia, again doses are less than post-herpetic neuralgia. They are 75 milligram twice a day. It can be increased to 150 milligram. And maintenance dose must be 300 to 450 milligram per day in divided dosage. We have already described that pregabalin is a class of anticonvulsant medication. It has been used in partial seizure as an adjuvant therapy, not a monotherapy. So, in the epilepsy, its dosage are slightly higher dosage. Initial dose is 150 milligram orally divided in 2 to 3 dosage. It can be increased weekly on the basis of clinical response and tolerability. Maintenance dose can be 150 milligram to 600 milligram per day in divided doses. And we can go up to maximum of 600 milligram per day. It can be used in children for epilepsy but not less than 1 month. FDA recommend its use in 1 month to less than 4 years of age and can be used in 17 years to older population. So, if a child is 1 month to less than 4 years and weight is less than 30 kg, initial dose is 3.5 milligram per kg in divided dosage. While if weight is 30 kg or greater, then its dose is 2.5 milligram per kg orally in 2 to 3 divided dosage. In 4 year and older, weight less than 30 kg, again 3.5 milligram per day, and so on. So, American Diabetes Association provides recommendation for the management of diabetes related complication including the neuropathy. Guidelines do not specifically mention pregabalin. They recommend the medication such as pregabalin, gabapentin, duloxetine for the treatment of painful diabetic neuropathy. The choice of medication should be individualized on patient characteristic and preferences. European Federation of the Neurological Society published guidelines for the pharmacological treatment of neuropathic pain, which includes the recommendation for diabetic neuropathy. They suggest that pregabalin is the first line treatment for the neuropathic pain, including the diabetic neuropathy. And it is important to note that these guidelines are not for the specific for the diabetes. It covers a broad range of neuropathic conditions. Thank you. Any questions?
Thank you so much, madam, for a wonderful presentation and very well elaborated all the points. Madam, we have 2 questions in chat box. Madam, can it be used with combination with antidepressants?
It can be used with antidepressant, but again, considering the side effects, like if a patient is having antidepressant that is somnolent, like that cause sedation, and we are using pregabalin along with that, then a patient will be sedated for the longer time and he cannot tolerate. So we will check the consideration, clinical condition of the patient, its characteristic, occupation, and all this, and it can be used with antidepressant. It is not contraindicated.
When we should start in epilepsy, failure of levetiracetam or another? That is question mark.
Levetiracetam is generally used for the generalized seizures. It is not very good in partial seizures. While pregabalin is approved for the partial seizures, I again told you it is adjuvant therapy. It is not a monotherapy. While levetiracetam can be considered as a monotherapy, yes, if it fails, if it is not able to continue to control the seizure, we can use pregabalin as an adjuvant to levetiracetam, as the adjuvant to valproate, as an adjuvant to lacosamide, but not as a monotherapy. So yes, it can be used when these drugs are not responding. Then we can use pregabalin because it also causes an anticonvulsant benefit.
Thank you, madam.
Yes, and third question is pregabalin improve the sleeping quality? Yes, it do improve the sleeping quality. Pregabalin is called somnolence. So when it is given in the night, it improves the sleep quality by 2 means. You all know that diabetic patients feel pain in the night. The burning pain, tingling sensation, and hyperesthesia, they are more common in night. So it decreases these pain and it causes sedation. So by two means, it improves the sleeping quality. So yes, you can say that pregabalin improves the sleeping quality.
Madam, another question is what we should do for a working person who can not afford the sedation of pregabalin because of his duty.
So we should not give the pregabalin in higher dosage to that patient, and we should ask the patient do take your tablets at night because pregabalin do cause sedation. So we ask the patient, I have mentioned you the dose 50, 75, 300, but pregabalin do come in 25 milligram also. So we can we can continue with the lower dosage, and we'll ask the patient if you feel sedation, then take the medication at night. Don't take medication in the morning.
Bundle of thanks, madam, for your nice presentation and conversation with the participants. Thank you so much, madam.
Any more questions?
Madam, please share your experience about the pregabalin in different indications. Where are you prescribing?
I'm using pregabalin for the very long time, for 5, 6 years. I have used pregabalin in neuropathic pain, and I have used pregabalin to improve the quality of sleep in certain patients, and it is very effective. For the diabetic neuropathy, it is a most effective drug. And I have also used it in trigeminal neuralgia. I have used this medication for carpal tunnel syndrome. It is causing benefit in those patients. So I have received very positive response from the pregabalin.
Madam, another question, difference between lacosamide and pregabalin for neuropathic pain.
Their mode of action is different. But otherwise, lacosamide can also be used in neuropathic pain. But FDA approved drugs is pregabalin and gabapentin. Lacosamide is off-label use for the neuropathic pain. Difference is their mode of action. Lacosamide does not cause sedation. The side effects of lacosamide and pregabalins are different. So they are two different class of drugs. But yes, lacosamide also is also effective in neuropathic pain, but not FDA approved.
Thank you so much, madam, for your time. Thank you.
Thank you.